Well, now I'll discuss dissociative as well as mood disorders and a little bit about schizophrenia in this segment. Well, dissociative disorders are those that involve a separation of critical parts of the personality that normally work together. This used to be known as kind of a split personality disorder, not known as that anymore. It's known as dissociative identity disorder, which is, two or more distinct personalities within the same person. Okay, again, used to be known as split personality, but it's not as accurate anymore. There could be two or more personalities, known as alters, for each individual. And dissociative amnesia, another type of dissociative disorder, such that you have significant selective memory loss. It usually comes in the form of repressed memories here. So this is where you have supposedly some evidence for repression, but it's quite rare. Okay. Dissociative fugue, also extremely rare. It's when you have an individual who takes a sudden impulsive trip, sometimes assuming a new identity. And they usually comes with dissociative amnesia, such that they don't remember their prior life. Well, mood disorders are disturbances in emotional feelings strong enough to interfere with daily living. It includes major depression. Also includes bipolar disorder. Okay, this kind of back and forth between depression and a manic state. Well, the key component with these mood disorders is that they interfere with daily living. Okay, it's certainly possible to be sad or a little bit depressed for a while, but unless it lasts a significant period of time and is really affecting you negatively every single day, harming your ability to just conduct your normal life, well then it could be qualified as an actual mood disorder. Well, I mentioned bipolar a little bit here. Alternating periods of mania and depression. This is another, in addition to major depression, fairly common mood disorder. Mania is an extended state of intense, wild elation, sort of the opposite of depression. A common drug to take, common medication is lithium for bipolar disorder, which really helps with the depressive state. It also helps with the manic state. It helps kind of maintain more of a balance so you don't swing into these extremes. But it can be really hard for a person with bipolar to stick with their medical regimen. They typically want to take medicine when they're going through the depression stage of bipolar, but then when they get to the manic stage, they really enjoy that, understandably. They're filled with energy and elation, and they feel like they're getting a lot done, and it's, if they don't take their medication then as well as during the depressive phase, then the medication doesn't work. Okay, you got to really take it regularly. Various causes of mood disorders include, of course, genetics and biochemical causes like neurotransmitter levels, and faulty cognitions as well. Okay, where you can get into this cycle of just negative thoughts. Okay, especially with major depression, where you just people with major depression report that they can't shake themselves out of these really negative thoughts. Okay, so there are some cognitive behavioral approaches that can address that. Well, schizophrenia here, I'll introduce it in this segment and end it in the next segment. Well, schizophrenia is a class. It's a whole class of disorders. It's not just one thing. Okay, these disorders are characterized by a severe distortion of reality, and that's kind of where you have to leave things with this broad definition, because there's so many different forms of schizophrenia. That's the one thing they have in common, is that there's some kind of distortion of reality that's fairly severe. So you have a decline from a previous level of functioning. You have to show that in order to be sort of labeled as having schizophrenia. You have to have disturbances of thought and language. Not always, but typically there are one or more delusions. It is not the same thing as a hallucination. A hallucination is something that's visual, or more commonly, it's auditory for schizophrenia, unlike what you see in the movies. A Beautiful Mind is an old movie by now, but the one with Russell Crowe, 2001, that illustrated a famous mathematician who had schizophrenia. But in the movie, they're depicted as visual hallucinations, whereas in reality they were primarily auditory. And that's really more common, is to have auditory hallucinations. A delusion is something quite different. That's just an incorrect, quite extreme kind of belief, such as that the person is Napoleon or something. That's a delusion. So I mentioned hallucinations and perceptual disorders here. These are cats drawn quite impressively by someone with schizophrenia, but it's a good way of illustrating how they at least at times, can perceive the world. Emotional disturbances also can come into play when it comes to schizophrenia. Okay, wild swings of emotion. Withdrawal from others is also quite common. Well, there are different types of schizophrenia depending upon when the symptoms develop. They can develop gradually, fairly early in life. Usually, there's an onset in your early 20s. Okay, I don't want to freak you out if you happen to be 21 years old or something, but if you're going to have schizophrenia, usually it's discovered by the time you turn 30. Okay. Reactive schizophrenia is not as common. It's a sudden, obvious onset of symptoms, usually with some kind of an environmental trigger. Positive symptoms exist as well as negative symptoms for schizophrenia, and this is kind of like what we learned in the learning topic, where positive doesn't mean good. Positive just means the presence of something that you don't want, okay, such as delusions and hallucinations. Okay, those are both positive symptoms. Negative symptoms is the absence of something that you do want. Okay, loss of functioning, social withdrawal, blunt emotions. Blunt just means kind of a flat affect, as it's called, where you're not really expressing emotions like you should. And this is another breakdown here. Later on, you can certainly pause this video and read these further, but I'm not going to dwell on these. But there are other ways of defining different types of schizophrenia. Paranoid schizophrenia is the most common, but you also have catatonic, undifferentiated, residual, and disorganized schizophrenia, so you can certainly read those definitions a bit later. Well, I'll go ahead and conclude my discussion of schizophrenia here. There's a clear biological influence in terms of genetics here. It's been shown that you have a 48% chance of having schizophrenia if you have an identical twin with schizophrenia, and it's not nearly that high if you just have a fraternal twin, a non-identical twin with schizophrenia. Okay, and there are some brain abnormalities that are shown to exist with people with schizophrenia. But there are also environmental factors, okay? It's especially with that sudden onset form of schizophrenia where you can have a trigger. The trigger could be an over-attention to stimulating the environment. That's one argument for schizophrenia, that maybe those individuals have just kind of they're over-tuned to the environment in a way. They're not filtering out as much as they should be. There is also this genetic predisposition model of schizophrenia, which states, and there's a great deal of support for it, states that you have an inborn predisposition to be sensitive to environmental stressors, that everyone is born with a certain kind of susceptibility to schizophrenia, to depression, to alcoholism, and so forth, and that predisposition could be very high or very low. If it's very high, you got to really watch out for certain triggers that can set it off and you end up with schizophrenia, okay? Or you can have a very low chance, a low genetic predisposition, and you can have lots of triggers, but you're still not going to get schizophrenia, okay? That's the argument of nature and nurture working together there. Okay, in the next segment, which will be the last segment of this lecture on psychological disorders, I will discuss personality disorders.